In this video, we're going to talk about something that affects millions of women, but often goes unrecognized: low estrogen levels. Have you been feeling unusually tired lately? Maybe you've noticed changes in your monthly cycle, or you're experiencing mood swings that seem to come out of nowhere. These could be signs that your estrogen levels aren't where they should be. Estrogen isn't just about reproduction. It's a key hormone that affects nearly every system in a woman's body. From your brain to your bones, from your heart to your skin, estrogen plays a crucial role in keeping your body functioning properly. When levels drop too low, the effects can ripple throughout your entire system, impacting your physical health, emotional well-being, and overall quality of life. Low estrogen is more common than you might think. While it's natural for levels to decline during menopause, many younger women experience estrogen deficiency too, due to stress, certain medical conditions, extreme exercise, or even some medications. The tricky part is that the symptoms can be subtle at first or might be mistaken for other health issues. That's why knowing the warning signs is so important. Catching low estrogen early can help you take steps to address it before more serious problems develop. In this video, we'll walk through 20 signs that might indicate your estrogen levels are lower than they should be. So let's dive in and learn how to recognize when your hormones might be out of balance. Let's start with one of the most noticeable signs: changes in your menstrual cycle. Estrogen is a key player in regulating your monthly periods. It helps build up the lining of your uterus each month in preparation for a potential pregnancy. When estrogen levels drop, this process gets disrupted. You might notice your periods becoming irregular, sometimes coming early, sometimes late, or even skipping months entirely. For some women, periods become unusually light or short. In more severe cases of low estrogen, periods might stop altogether, a condition called amenorrhea. Research shows that even modest decreases in estrogen can disrupt the delicate hormonal balance needed for regular menstruation. This disruption happens because estrogen works closely with other hormones like progesterone in a carefully orchestrated monthly dance. When estrogen drops too low, this hormonal choreography falls apart. Your brain might not send the right signals to your ovaries, or your ovaries might not respond properly. The result? Your cycle becomes unpredictable or stops. If you've noticed persistent changes in your menstrual cycle, especially if you're not approaching menopause age, it's worth paying attention. While occasional irregularities can happen due to stress or illness, ongoing changes could be your body's way of signaling that something's off with your estrogen levels. Another common and often uncomfortable sign of low estrogen is vaginal dryness. Estrogen helps keep your vaginal tissues healthy, elastic, and well lubricated. When levels decline, these tissues can become thinner, less elastic, and much drier. Many women describe this dryness as a constant discomfort that can range from mild irritation to painful burning. It often makes intimacy uncomfortable or even painful, a condition doctors call dyspareunia. Studies show that up to 60% of women with low estrogen experience some degree of vaginal dryness. This happens because estrogen stimulates the production of natural moisture in your vaginal tissues and helps maintain their thickness and elasticity. It also helps maintain the slightly acidic environment that keeps your vaginal microbiome healthy. Without sufficient estrogen, these processes slow down. Beyond physical discomfort, vaginal dryness can impact your quality of life and intimate relationships. Many women feel embarrassed to discuss this symptom, even with their doctors, but it's important to recognize that it's a common physiological response to hormonal changes, not something you need to silently endure. Sleep problems are another telltale sign that your estrogen might be running low. Many women with estrogen deficiency report difficulty falling asleep, staying asleep, or getting restful sleep even when they do sleep through the night. Estrogen interacts with other hormones and neurotransmitters that regulate your sleep-wake cycle. It affects how your body produces melatonin, your sleep hormone, and influences brain chemicals that help you relax and fall asleep. Research published in the Journal of Sleep Research has found that women with lower estrogen levels typically experience poorer sleep quality and more frequent sleep disturbances. You might find yourself waking up multiple times during the night or lying awake for hours unable to fall back asleep. Some women describe feeling exhausted in the morning despite getting a full night's rest. These disruptions can leave you feeling foggy, irritable, and depleted during the day. What makes this particularly challenging is that poor sleep can then create a vicious cycle. Lack of quality sleep can further disrupt your hormonal balance, potentially worsening your estrogen deficiency and other symptoms. If you've noticed persistent changes in your sleep patterns alongside other symptoms we're discussing, your estrogen levels might be worth investigating. Hot flashes and night sweats are perhaps the most well-known signs of low estrogen, especially during menopause, but they can affect women of any age who are experiencing estrogen deficiency. A hot flash feels like a sudden wave of heat that spreads throughout your upper body and face. Your skin might redden, you may start sweating profusely, and your heart might race. These episodes can last from a few seconds to several minutes. Night sweats are essentially hot flashes that occur during sleep, often causing you to wake up drenched in sweat, needing to change your clothes or bedding. These temperature regulation issues happen because estrogen helps your brain, specifically your hypothalamus, control your body temperature. When estrogen levels fluctuate or drop, your hypothalamus can mistakenly detect that you're too hot when you're not. This triggers your body's cooling mechanisms, dilating blood vessels and activating sweat glands, even though you don't actually need cooling. Research from the Mayo Clinic shows that up to 80% of women experiencing significant estrogen decline deal with hot flashes or night sweats. For some, these episodes are mild and infrequent. For others, they can occur many times daily and severely impact quality of life. While not dangerous, they can be incredibly disruptive to your daily activities, sleep, and comfort. Mood changes are another significant sign of low estrogen that many women experience. You might find yourself feeling unusually irritable, anxious, or down without an obvious cause. Some women describe feeling like they're on an emotional roller coaster, with moods shifting rapidly and unpredictably. The connection between estrogen and mood is deeply rooted in brain chemistry. Estrogen influences the production and activity of neurotransmitters that regulate mood, including serotonin, dopamine, and norepinephrine. These are the same brain chemicals targeted by many antidepressant medications. When estrogen levels drop, the activity of these mood-regulating chemicals can change significantly. Research published in the Archives of Women's Mental Health shows that times of estrogen fluctuation or decline are associated with increased vulnerability to mood disorders. In fact, women are 2 to 3 times more likely to experience depression during perimenopause, when estrogen begins to decline, than at other times in their lives. You might notice that your emotional responses seem out of proportion to the situations triggering them. Small frustrations might lead to intense irritability, or you might feel tearful over minor disappointments. Some women also report a persistent low mood or a sense of flatness, like the color has drained from their emotional life. While everyone experiences mood fluctuations, persistent or significant changes that affect your daily functioning and relationships could signal hormonal imbalance. It's particularly telling if these mood changes coincide with other symptoms of low estrogen. Your bones might not give you obvious symptoms of low estrogen right away, but decreased bone density is a serious concern associated with estrogen deficiency. Estrogen plays a crucial role in maintaining bone strength throughout your life by helping balance the activity of cells that build bone, osteoblasts, and cells that break down bone, osteoclasts. When estrogen levels drop, this balance tips in favor of bone breakdown. The result is a gradual loss of bone density, which can eventually lead to osteopenia, mild bone loss, or osteoporosis, more severe bone loss that increases fracture risk. Research published in the Journal of Clinical Endocrinology and Metabolism has shown that even young women with low estrogen can experience significant bone density loss. The challenge with this symptom is that you typically won't feel bone loss happening. The first sign might be a fracture that occurs with minimal trauma, like breaking a wrist from a minor fall. Some women may notice a decrease in height over time or developing a curved upper back, sometimes called a dowager's hump. Regular bone density screening becomes increasingly important as you age, especially if you have other risk factors or symptoms of low estrogen. While bone loss isn't reversible, identifying it early allows for interventions that can slow the process and reduce fracture risk. Weight changes, particularly unexplained weight gain, can be a frustrating sign of low estrogen. You might notice pounds creeping on even though your diet and exercise habits haven't changed. Even more telling is a shift in where you carry weight. Low estrogen often leads to increased fat around the abdomen, even in women who previously carried weight elsewhere. Estrogen influences how your body stores and distributes fat, as well as how efficiently you burn calories. It also affects other hormones involved in metabolism and appetite regulation. When estrogen drops, your metabolic rate can slow down, meaning you burn fewer calories at rest. Research in the International Journal of Obesity has linked low estrogen states with changes in fat distribution and increased difficulty maintaining a healthy weight. This hormonal shift can also increase cravings for carbohydrates and sweets as your body seeks quick energy to compensate for metabolic changes. You might find yourself unusually hungry or having strong food cravings that are difficult to resist. The combination of slower metabolism, increased appetite, and changes in fat storage creates a perfect storm for weight gain, particularly around the midsection. This pattern of central weight gain is especially concerning because abdominal fat is associated with higher risks of heart disease and other health problems. If you've noticed unexplained weight changes, particularly an increase in abdominal fat that's resistant to your usual healthy habits, low estrogen could be a contributing factor worth investigating. Brain fog is how many women describe the cognitive changes that can come with low estrogen. You might find yourself forgetting words mid-sentence, misplacing items, or having trouble concentrating on tasks that were previously easy for you. Some women report difficulty learning new information or feeling mentally fuzzy. These cognitive changes happen because estrogen plays important roles in brain function. It increases blood flow to the brain, protects brain cells from damage, and influences the growth and activity of neurons and their connections. Estrogen also affects the production and activity of neurotransmitters involved in memory and cognitive processing. Research published in the journal Neurology has found that estrogen fluctuations and decline can temporarily affect verbal memory, attention, and how quickly you can process information. While these changes don't indicate dementia or permanent cognitive decline, they can be frustrating and impact your productivity and confidence. You might notice that you need to work harder to stay focused during meetings, or that you're making uncharacteristic mistakes in tasks that require attention to detail. Some women report having to create more lists and reminders to compensate for memory lapses. These cognitive symptoms can be particularly distressing because they affect how you function in daily life, including at work and in your personal relationships. They may even cause you to question your abilities or worry about more serious cognitive conditions. Understanding that these changes may be linked to hormonal fluctuations can provide some reassurance and guide you towards appropriate support. Headaches that seem tied to your hormonal cycles can be another sign of estrogen imbalance. You might notice patterns of headaches or migraines that occur with hormonal fluctuations, like right before your period starts or more frequently if your cycles have become irregular. Estrogen affects blood vessels in your brain and influences chemicals that regulate pain perception. When estrogen levels change, especially when they drop suddenly, it can trigger headaches or migraines in susceptible women. Research published in the journal Headache has shown that about 60% of women who experience migraines report a connection between their headaches and hormonal changes. These hormone-related headaches often have distinctive characteristics. They might be accompanied by nausea, sensitivity to light and sound, or visual disturbances called aura. Some women describe the pain as throbbing or pulsating, typically affecting one side of the head more than the other. If you've noticed an increase in headache frequency or intensity that seems to coincide with other symptoms we've discussed, or if you can see a pattern related to your menstrual cycle, hormonal factors could be contributing to your headaches. Joint pain that can't be explained by injury or another condition might also signal low estrogen. You might notice your joints feeling stiff, achy, or swollen, particularly in the mornings or after periods of inactivity. The pain might affect multiple joints, including knees, hips, shoulders, and hands. Estrogen helps suppress inflammation throughout your body and plays a role in maintaining the collagen that supports your joints. It also affects how your body processes pain signals. When estrogen levels drop, inflammation can increase, and the cushioning collagen in your joints may deteriorate more quickly. Research published in Arthritis Research and Therapy has found that women often experience increased joint pain during times of estrogen decline. This connection explains why many women notice the onset or worsening of joint issues during perimenopause or menopause. However, younger women with low estrogen can experience these symptoms too. You might find that activities you previously enjoyed, like hiking or gardening, now cause discomfort that lingers for days. Or you might notice that your hands feel stiff and achy when you wake up, improving somewhat as the day progresses. While many conditions can cause joint pain when it appears alongside other symptoms of hormonal imbalance, estrogen deficiency could be a contributing factor. This type of joint pain often responds well to treatments that address the underlying hormonal issues. Changes in sexual desire and function are common with estrogen deficiency. You might notice a decline in your interest in sex or find that becoming aroused takes longer than it used to. Some women also experience decreased sensitivity and difficulty reaching orgasm. Estrogen supports sexual function in multiple ways. It maintains blood flow to the genital tissues, keeps vaginal tissues healthy and sensitive, and influences brain chemicals involved in sexual desire and arousal. when estrogen drops, these physical and neurochemical processes can be disrupted. Research in the Journal of Sexual Medicine has found that up to 45% of women with low estrogen report decreased sexual desire and satisfaction. This change can be confusing and distressing, especially when it affects long-established relationship patterns. Beyond the physical aspects, the emotional symptoms of low estrogen, like mood changes and fatigue, can further diminish interest in sexual activity. And if intercourse becomes uncomfortable due to vaginal dryness, you might begin avoiding it, creating a cycle that's difficult to break. It's important to recognize that changes in libido can stem from many factors, including relationship issues, stress, and certain medications. However, when decreased sexual desire occurs alongside other symptoms we've discussed, hormonal factors may be playing a significant role. Urinary issues are another common but less discussed sign of low estrogen. You might find yourself needing to urinate more frequently or urgently, sometimes with little warning. Some women experience increased urinary tract infections or notice leaking urine when coughing, sneezing, or exercising. These problems occur because estrogen helps maintain the health of your urinary tract tissues. The bladder, urethra, and supporting pelvic floor muscles all have estrogen receptors. When estrogen levels drop, these tissues can become thinner and less elastic, affecting bladder function and control. Research published in Menopause. The Journal of the North American Menopause Society has found that up to 70% of women with low estrogen experience some form of urinary symptoms. The urinary tract and vagina develop from the same embryonic tissues, so it's not surprising that both areas are similarly affected by estrogen deficiency. You might notice that you're getting up multiple times at night to urinate, disrupting your sleep, or you might find yourself mapping out bathroom locations whenever you go somewhere new, due to worry about sudden urges. Some women report a burning sensation during urination, even when tests show no infection is present. These urinary changes can significantly impact your confidence and quality of life, sometimes leading to social isolation or avoidance of activities you once enjoyed. Understanding the connection to estrogen can help you seek appropriate care rather than simply coping with these symptoms. Changes in your skin and hair are visible signs that estrogen levels may be declining. You might notice your skin becoming drier, thinner, or less elastic. Fine lines and wrinkles might appear more quickly or become more pronounced. Some women also experience increased acne despite having left their teenage years far behind. With your hair, you might notice increased thinning or shedding. Your hair may grow more slowly or become drier and more brittle. Some women also report changes in their hair's texture or increased facial hair growth as the balance between estrogen and testosterone shifts. These changes happen because estrogen stimulates collagen and oil production in your skin, helping it stay thick, moist, and elastic. Estrogen also influences hair growth cycles and helps counterbalance the effects of testosterone on your skin and hair follicles. When estrogen drops, these protective effects diminish. Research in the journal Dermatologic Therapy has documented how skin thickness decreases by about 1.13% per year after menopause, when estrogen levels are consistently low. This thinning makes skin more fragile and prone to injury. You might find that products that previously worked well for your skin no longer seem effective, or you might notice that minor cuts and scrapes take longer to heal. Some women find themselves dealing simultaneously with dry, aging skin and adult acne, a frustrating combination that can affect self-esteem. While skin and hair naturally change with age, accelerated or unusual changes could signal hormonal shifts that might benefit from attention and treatment. Heart palpitations, feeling like your heart is racing, pounding, fluttering, or skipping beats, can be an unsettling sign of low estrogen. You might become suddenly aware of your heartbeat while resting, or notice episodes of rapid heartbeat that come out of nowhere. These palpitations occur because estrogen affects your cardiovascular system in several ways. It helps keep blood vessels flexible, influences how your body handles stress hormones like adrenaline, and may affect the electrical system that controls your heartbeat. When estrogen drops, these regulatory effects diminish. Research published in the journal Climacteric found that about 40% of women experience heart palpitations during perimenopause and menopause. While usually harmless, these sensations can be frightening and may contribute to anxiety. You might notice that palpitations often accompany hot flashes or episodes of anxiety. Some women report waking from sleep with a racing heart, sometimes in conjunction with night sweats. Others find that certain triggers, like caffeine, alcohol, or stress, are more likely to cause palpitations when their estrogen is low. While most hormone-related palpitations aren't dangerous, any new or concerning heart symptoms should be evaluated by a healthcare provider to rule out other causes. Once cleared medically, understanding the connection to hormonal changes can help reduce the anxiety these sensations often provoke. Digestive problems are often overlooked as a sign of low estrogen, but many women notice changes in their gut function as their hormones fluctuate. You might experience more bloating, gas, or abdominal discomfort. Some women develop new food sensitivities or find that their bowel habits change, either toward constipation or more frequent bowel movements. These digestive changes occur because your entire digestive tract has estrogen receptors. Estrogen influences how quickly food moves through your system, affects the muscle contractions in your intestines, and helps maintain the mucus lining that protects your gut. It also interacts with your gut microbiome, the community of bacteria that aids digestion and supports immune function. Research in the World Journal of Gastroenterology has shown that women often experience changes in gut function during times of hormonal fluctuation. Studies have found that up to 40% of women report increased digestive symptoms during perimenopause and menopause. You might notice patterns in your digestive symptoms, perhaps they worsen at certain points in your menstrual cycle, or have generally increased as other symptoms of estrogen deficiency have appeared. Some women find that foods they previously tolerated well now cause discomfort. If you've developed persistent digestive issues alongside other symptoms we've discussed, hormonal factors could be contributing to your digestive distress. Addressing the underlying hormonal imbalance may help improve these symptoms. Changes in your breasts can signal shifting estrogen levels. You might notice your breasts feeling less full or appearing more droopy. The tissue might feel different, less dense and more fatty. Some women also experience increased breast tenderness or sensitivity even outside of their regular menstrual cycles. These changes happen because breast tissue is highly responsive to estrogen. Throughout your life, estrogen stimulates the development of milk-producing glands and supporting tissues in your breasts. It helps maintain breast fullness and skin elasticity. When estrogen declines, the glandular tissues can shrink and skin elasticity diminishes. Research published in the journal Climacteric has documented how breast density typically decreases as estrogen levels decline with age. This is actually one positive aspect of lower estrogen, as dense breast tissue can make mammograms harder to interpret and is associated with increased breast cancer risk. You might notice that your bras fit differently or that the overall shape of your breasts has changed. Some women find they need to switch to different styles of bras to accommodate these changes. The skin of your breasts might also become drier and less elastic, contributing to the appearance of sagging. While breast changes are a normal part of aging, significant or sudden changes could reflect hormonal shifts that might benefit from medical attention, especially if they occur alongside other symptoms we've discussed. Dry eyes might seem like a minor issue, but they can be surprisingly uncomfortable and are strongly linked to estrogen levels. You might notice your eyes feeling gritty, burning, or irritated. Some women experience more frequent redness or find that their eyes tear up in response to irritation, even though they feel dry. These symptoms occur because estrogen helps stimulate tear production and maintains the quality of your tears. Your tears aren't just water, they're a complex mixture of water, oils, and mucus that work together to lubricate and protect your eyes. Estrogen helps ensure this mixture has the right balance to prevent evaporation and provide smooth coverage over your eye surface. Research in the journal Cornea has found that up to 60% of women in perimenopause and menopause experience dry eye symptoms. Studies show that tear production can decrease by as much as 30% during periods of low estrogen. You might find yourself using eye drops frequently or feeling like something is in your eye when nothing is there. Some women notice their eyes feeling particularly dry during focused tasks like computer work or reading. Contact lens wearers may find their lenses become uncomfortable or cannot be worn for as long as before. While many factors can contribute to dry eyes, when the symptom appears alongside other signs of hormonal imbalance, estrogen deficiency may be playing a significant role. Addressing the underlying hormonal issues can sometimes improve eye comfort more effectively than just treating the eyes directly. Fatigue that doesn't improve with rest can be one of the most debilitating signs of low estrogen. You might feel exhausted even after a full night's sleep, or find your energy crashing at certain points in the day. Some women describe it as feeling heavy or like they're moving through molasses. This profound tiredness occurs because estrogen influences your energy production at a cellular level. It affects how your body uses glucose for fuel, impacts your metabolism, and influences blood flow and oxygen delivery to your tissues. Estrogen also helps regulate your sleep cycles and stress response, both critical for energy management. Research published in the Journal of Clinical Endocrinology and Metabolism has linked low estrogen states with increased markers of cellular stress and decreased energy production in mitochondria, the powerhouses of your cells. You might notice that activities that used to energize you now leave you depleted. Exercise might feel more difficult, or you might need more recovery time afterward. Some women find they need to carefully pace their activities throughout the day to manage their limited energy reserves. While fatigue can result from many conditions, when it appears alongside other symptoms we've discussed, especially sleep disruptions and mood changes, hormonal factors could be significant contributors. Understanding this connection can guide you toward more effective solutions than simply pushing through the exhaustion. Changes in your nails might seem like a minor cosmetic issue, but they can reflect your internal hormonal balance. With low estrogen, you might notice your nails becoming more brittle, peeling, or breaking more easily. They might develop ridges or grow more slowly than before. These changes happen because estrogen helps maintain the moisture content and structural proteins in your nails. It also supports healthy blood flow to your nail beds and affects how your body absorbs and uses nutrients important for nail growth, like calcium and iron. Research published in the International Journal of Cosmetic Science has documented how nail thickness and growth rate typically decline during times of estrogen deficiency. Studies show that up to 30% of women experience noticeable nail changes during perimenopause and menopause. You might find yourself needing to keep your nails shorter to prevent breaking, or notice that polishes and treatments that previously worked well no longer seem effective. Some women report that their nails split or peel in layers, making it difficult to maintain their appearance. While not medically serious, these nail changes can be frustrating and may serve as a visible indicator of internal hormonal shifts that are affecting other aspects of your health as well. Anxiety that seems disproportionate to your circumstances can be a distressing sign of low estrogen. You might find yourself worrying more than usual, feeling tense or on edge without clear cause, or even experiencing panic attacks. Some women report a constant sense of unease or dread that they can't shake. This increased anxiety happens because estrogen helps regulate neurotransmitters that influence mood and stress responses, particularly serotonin, GABA, and dopamine. Estrogen also affects how your body processes stress hormones like cortisol. When estrogen drops, these stress-moderating effects diminish, potentially leaving you more vulnerable to anxiety. Research published in JAMA Psychiatry has found that times of hormonal fluctuation and estrogen decline are associated with increased risk of anxiety disorders. Studies show that up to 50% of women report increased anxiety symptoms during perimenopause. You might notice that your anxiety has specific triggers that didn't bother you before, or find that your worries are harder to quiet with previously effective coping strategies. Some women experience physical symptoms of anxiety, like chest tightness, racing heart, or shortness of breath, that can be frightening in themselves. While anxiety has many potential causes, when it develops or worsens alongside other symptoms we've discussed, hormonal factors could be significant contributors. Understanding this connection can help guide you toward appropriate support rather than simply trying to manage escalating worry on your own. Now that we've covered the 20 signs of low estrogen, let's talk about what you can do if you recognize these symptoms in yourself. Remember, addressing hormonal imbalances often requires a comprehensive approach. First, consider your dietary choices. Certain foods can naturally support healthy estrogen levels. Flax seeds, soybeans, chickpeas, and lentils contain plant compounds called phytoestrogens that can help ease symptoms of low estrogen. Adding more fruits, vegetables, and whole grains provides essential nutrients that support hormone production and metabolism. Regular physical activity is also important, but finding the right balance is key. While extreme exercise can actually lower estrogen levels further, moderate exercise supports hormonal health. Activities like walking, swimming, yoga, and strength training can be particularly beneficial. Aim for about 150 minutes of moderate activity each week, but listen to your body and avoid overdoing it. Stress management deserves special attention, as chronic stress can disrupt hormone production. Techniques like deep breathing, meditation, and mindfulness have been shown to help balance hormones. Even small daily practices like taking a few minutes for deep breathing or spending time in nature can help reduce stress hormones that might be interfering with your estrogen balance. Getting adequate sleep is crucial too. Prioritize good sleep hygiene by keeping a consistent sleep schedule, creating a comfortable sleep environment, and limiting screen time before bed. Since sleep problems can be both a cause and a consequence of hormone imbalance, improving your sleep can create positive effects throughout your body. For many women, these lifestyle approaches may need to be combined with medical support. If you're experiencing significant symptoms, consider consulting with a healthcare provider who specializes in women's hormonal health. They can test your hormone levels and discuss appropriate treatment options, which might include hormone therapy or other medications depending on your specific situation and health history. Remember that addressing hormonal imbalances takes time. Be patient with yourself and know that even small changes can add up to significant improvements in how you feel. To wrap up, understanding the signs of low estrogen can help you recognize when your hormones might be out of balance and take steps to address the underlying issues. From irregular periods and sleep problems to mood changes and physical symptoms, these signs are your body's way of communicating that something needs attention. The good news is that many of the symptoms we've discussed can improve with appropriate intervention. Whether through lifestyle changes, natural remedies, or medical treatments, there are ways to support your hormonal health and reduce the impact of low estrogen on your daily life. Remember that hormonal health isn't one size fits all. What works for one woman might not be right for another. It's important to work with healthcare providers who listen to your concerns and help you find personalized solutions. Don't dismiss your symptoms or try to push through them. Your body's signals deserve attention. With the right support and strategies, you can navigate hormonal changes more comfortably and maintain your well-being through various life stages. We hope this video has helped you better understand how estrogen affects your body and recognize potential signs of imbalance. If you found this information helpful, please like this video and subscribe to our channel for more health content designed specifically for women. Share your experiences or questions in the comments below. Your insight might help other women recognize their own symptoms and seek the support they need. In our next video, we'll be discussing natural ways to support hormone balance through specific dietary changes. Click the link on screen now to make sure you don't miss it. Until next time, listen to your body. It has wisdom to share.